Hey guys, my name is Emily and I am one of the wellness interns this summer at Carolina Bay. I graduated from the University of North Carolina, Wilmington in December with my undergraduate degree in recreation therapy, and I'm currently in the master's program to get my master's degree in gerontology. And so today I kind of have a quick presentation to present with you guys today. So this is going to be an info session about dementia. So before we begin, I just had a couple of questions that I want to ask you guys, and just keep these questions kind of in the back of your mind as we go through this presentation together. First and foremost, I'm going to have a discussion group on the 21st of July, and I believe it's going to be in the forum. So I just wanted to kind of present the information beforehand so that you guys are able to go through this presentation and develop any questions that you may have. And I would be happy to answer them to the best of my knowledge on that Wednesday, the 21st. So before we begin, what is your biggest hope for this class or for this information session? And is there anything in particular that you want to learn? Okay, so what is dementia? What do you think dementia is? And do you know of any signs or symptoms of dementia? And I included a picture here, and on the left-hand side, you see a picture of a healthy brain. And on the right-hand side, you see a picture of someone who has severe Alzheimer's disease. So as you may or may not know, dementia is a progressive disease, and it does cause memory loss, problems with language, problem-solving abilities, and other cognitive functions that interfere with daily living. So dementia is kind of an umbrella term, and it goes into, there are multiple different types of dementia. Alzheimer's is the most common type, and it accounts for about 60 to 80% of all dementias. And so there are 5 types of dementia. There's Alzheimer's, which we know that to be the most common type, Lewy body dementia, vascular dementia, frontotemporal dementia, Parkinson's/Huntington's, and even a mixture of various dementias with multiple causes. So altogether, the dementia is kind of, think of it as an umbrella term. So there are multiple different types of dementia. And so going right in, we have 10 early signs and symptoms of Alzheimer's disease. And I got all of this information from the Alzheimer's Association. And I suggest that if you guys have any other questions or concerns or anything like that after this presentation, to go to the Alzheimer's Association, I think it's .org, and look on their website, and they have a lot of information and resources on there. So according to the Alzheimer's Association, the 10 early signs and symptoms of Alzheimer's disease consist of memory loss that disrupts daily living, challenges in planning or problem solving, difficulty completing familiar tasks, confusion with time or place, trouble understanding visual images and spatial relationships, new problems with words in speaking or writing, misplacing things and losing the ability to retrace steps, decreased or poor judgment, withdrawal from work and or social activities, and changes in mood or personality. So think right now, do you guys know anyone who has any of these signs or symptoms? Or maybe you have a loved one who has been diagnosed with Alzheimer's disease or a form of dementia. And did they present with any of these signs and symptoms? So sometimes we kind of are our worst critic, and we may think that we have a problem when there really isn't one. So this slide is kind of, think of it as kind of a pro, con, or a versus kind of thing. So we have the early signs and symptoms of Alzheimer's and dementia, and there's typical age-related changes that we go through just by getting older. And so some of those are, it is normal to sometimes forget names or appointments, but remembering them later. So it becomes a problem when you forget, but you don't remember that you made that appointment, or you can't remember the facts later. It is normal to make an occasional error in finances or household bills. It is normal to occasionally need help organizing a grocery list or remembering the rules to a favorite board game. It is normal to get confused about the day of the week, but figuring it out later. It is normal to have vision changes related to cataracts. It is normal to sometimes have trouble finding the right words. It is normal to misplace things from time to time and retracing your steps back to find them. It is normal to make a bad decision or a mistake once in a while, like postponing a doctor's appointment. It is normal to sometimes feel uninterested in family or social obligations. It's okay to say no or to not want to do something. And lastly, it is okay to develop very specific ways of doing things and becoming irritable when a routine is disrupted. So these are some of the ways that normal aging, we go through changes as we get older, and these are normal age-related changes. And so it's also a good way to prevent dementia is kind of understanding the risk factors that are associated with this progressive disease. And so listed on this slide, I have some of the risk factors that are associated: diabetes, hypertension, depression, inactivity, smoking, low cognitive activity, obesity, alcohol, and high cholesterol. So definitely pay attention to any of these risk factors and talk to your doctor if you are concerned at all. So moving on, we have 10 tips to love your brain. So this is kind of the slide I want us to focus on the most throughout this presentation, since this is a presentation on how to prevent dementia. There is no cure for dementia or any way to kind of slow it down, since it is a progressive disease. But there are ways to keep our brain healthy. Just like how we exercise to keep our body healthy, we need to exercise our mind as well. So the first one the Alzheimer's Association wanted to point out was to break a sweat. Engage in regular cardiovascular exercises that elevates your heart rate. And we here at Carolina Bay have a lot of those exercise classes that are available to you guys. So definitely partake in some of those classes and keep your heart rate elevated. And this doesn't have to be a particular group class that Carolina Bay offers. It could be, going outside and walking your dog, or doing a leisure walk, playing ping pong, tennis, whatever you like. The next one is hit the books, take a class, learn something new. The best way to challenge your brain is to keep those neurotransmitters firing and firing new pathways in the brain. It's kind of like a use it or lose it type of technique. So hit the books, find something new, take a class. The third one is butt out, quit smoking. Quitting smoking can reduce the risk of cognitive decline immensely. And number 4, follow your heart. Risk factors include obesity, high blood pressure, and diabetes. So make sure you're taking care of that heart first and foremost, because a healthy heart helps us have a healthy mind and helps us have a healthy body. Number 5, they call it heads up. Brain injuries can increase the risk, so be safe. Make sure you wear a seatbelt, a helmet, and partake in fall prevention. So if you are scared of falls, actually, fun fact for you, a lot of falls happen because people are scared of falling. So if you are nervous or scared of falling, there are a lot of balance classes here to help you maintain and improve on your balance so that you can feel more confident and less scared to fall. So number 6 is fuel right up. Eat healthy. There's Mediterranean diets, and the DASH diet is a dietary approach to stop hypertension. So just making sure you're eating a good balanced breakfast, lunch, and dinner, as well as eating your vegetables and staying hydrated. That is very important as well. Number 7 is catch some Z's. Get some good sleep and get help for insomnia or sleep apnea if you may have it. So getting a good quality night's rest is very, very important. Number 8, take care of your mental health. Depression and anxiety are risk factors, so seek treatment if you have any of these or think that you may have them. So your mental health plays a huge part in your body of getting that whole well-rounded approach. So we want to make sure that our mind is healthy, our body is healthy, our hearts are healthy, and our brains are healthy. So moving right along, we have number 9, and that is buddy up. Maintain social engagements to support your brain health. Social engagements and social support, friends, family members, all of that is super important now as we get older. So make sure to maintain those social engagements and also have you a good laugh from time to time. And lastly, 10, stump yourself. Challenge and activate your mind. Like I said in number 2, it is very important to maintain those neural pathways and those neurotransmitters and keeping everything in tip-top shape. So examples to engage your mind are build something, complete a jigsaw puzzle, games, bridge, word searches, Sudoku, or anything that makes you think strategically, critically, artistically, or educationally. I know there are always people in, I don't know what room that is, but always doing the puzzles and playing bridge, and Farkle. So anything that you can do to maintain those critically thinking skills, keeping that brain moving and working. So yes. And here at Carolina Bay, there is a class called Ageless Grace, and it has a lot of tips and tricks to maintain and improve your cognitive brain health and functioning. It is a seated class that happens in the studio every Monday at 11:30. This class is designed to get the body moving through the utilization of brain games. So this is a fun way to keep the body moving without even realizing it right here at home at Carolina Bay. And these are my references. So I just wanted to thank you guys for coming out and just listening to this quick little presentation. And I hope to see you guys on Wednesday, the 21st. Please bring any questions that you may have. It is going to be a discussion-based group. So I will be asking you guys some questions, and I'm here to answer any questions that you guys may have. Then again, I'm not an expert, but I will try to the best of my ability to answer whatever questions you guys may have. And I look forward to seeing you guys there. Thanks. Bye, guys.